Right. Hi, everyone. Welcome to this information session provided by the Department of Population, Family, and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. My name is Sally Safi, and I'm the Director of Graduate Studies in the department. We're excited that you have joined us today to learn about our department and the programs we offer, as well as how our students are engaged in work with our faculty here. I'm going to give a very brief intro of our department, and then we'll spend the bulk of our time today hearing from current students and faculty about their research. They're going to discuss projects on which they collaborate to give you a sense of opportunities beyond the classroom that are available to students. After we hear from our student and faculty pairs, the education team will stay on and share information about our degree programs, including our Master of Science in Public Health, or MSPH program, our Master of Health Science program, or MHS, and our PhD program. And we'll also give some info about applying to the department and have plenty of time to answer your questions. Feel free to put any questions that you have in the chat or raise your hand, and we'll be sure to get to everybody's questions. So just a little bit about the department. We are one of 10 departments at the School of Public Health here at Johns Hopkins. So the department has a long and rich history. Decades ago, the Department of Population Dynamics merged with the Department of Maternal and Child Health, and we became the Department of Population, Family, and Reproductive Health, which I know is a bit of a long name. And the work of our department is diverse, but we're united in our focus on promoting health and well-being across the life course. So we use a multi-level life course framework to understand public health issues and the interplay of biological, behavioral, societal, and other factors across a person's life and across generations. And this framework really helps us to advance health equity through effective public health research and practice. Students in the department select an area of interest within PFRH and drill down and focus on one of these areas of interest shown here. In practice, there's a lot of overlap across these areas. So courses that we offer can fall into multiple categories, and faculty work often does not fit neatly into just one of these boxes. But rather than constrain students, these areas are really meant to help guide students select coursework and refine their interests as they're here in the department. And so we're going to talk today about themes, I think, from multiple areas shown on the screen. Like I said, at about 12:30, we're going to turn to discussion of PFRH degree programs and the application process. But right now, I would like to turn the discussion with our students and faculty. So I'm going to stop sharing my screen. And I'm delighted to first welcome Dr. Terry Powell and our MSPH student Drishti. And I'll ask you to go ahead and introduce yourselves.
Drishti, you can start.
Hi, guys. My name is Drishti, and I'm a second year MSPH candidate in the PopFam department. We call ourselves PopFam. It's a short name we've given ourselves. And I specialize, my concentration is women's reproductive and sexual health.
And my name is Dr. Terry Powell. I have been in the department for almost 15 years. And I conduct research on adolescent health. So I work with schools, families, churches, and anybody who is a part of a young person's life to ensure that young people are safe, healthy, hopeful, and connected.
Great. Thanks so much. So we would love to hear today about the project that you are working on together. Can you tell us a little bit about maybe the research question that you're trying to answer in the project and the specific roles that you have on the project?
Yes, of course. So, okay, awesome. So Dr. Powell and I are working on systematic review examining how community partners define and engage in research related to medications for opioid use disorder. The goal is to understand what meaningful engagement looks like in these studies and how partnerships shape intervention design and outcome. I began working with Dr. Powell over the summer, screening over 1,700 titles and abstracts to assess inclusion eligibility. I have now continued to assess the full text review. And once this review is complete, I'll be a co-author on this manuscript.
Yeah, and I think that one of the things that I wanted to piggyback on what Sally said, research, our department really does like span, right? Like, so I focus on adolescent health, but because I specialize in partner engagement, I'm able to work on national teams. And so the work that we're doing is actually a team that is based out of Stanford, who is interested in addiction medicine, but because like our school has a big focus and strong expertise in community engagement, they invited us to be a part of it. And then the second thing is, like whatever you think about research, right? I think usually people think like of collecting data, but research like expands the gamut, right? And so this particular thing, like we're just looking at all of the other research that's already been created as a part of a systematic review. And so, yeah, like Drishti said, she screened 1,700 articles, but there were over 5,000 that we started with of people who are already talking about community partnerships and medication for opioid use disorder treatment.
Great, thanks. Drishti, do you want to tell us maybe a little bit more about like your day to day and what types of activities you're doing, or maybe a big takeaway from the project so far that you've learned?
So, I think the daily life of an MSPH student starts with getting, first of all, waking up. I hope everybody has a good schedule, but it's very important that we get our sleep. We have so much research. And now, because we are studying so many papers and every day we read so many papers, I think we've become a more little conscious. So, we get our, daily nutrition in, and then we usually head to school. Our school is awesome. It's a 24-hour facility. So at any point of the day, even if at night we feel like the write is kicking in, so we can just go to school. So at MSPH is almost always stuck to the screen. We do take breaks. We have a beautiful ninth floor. The BSPH is a beautiful ninth floor, which is a great view. So great for mental health. And it has a gym. So if you just want to take a break and take a walk inside the campus and not outside when it's cold and freezing, you can do that on the ninth floor itself. And apart from that, this research has been I think it's just taught me time management above everything, because I have always been reading, but because there were so many papers and there were so many other tasks also happening at the same time. I think personally I have been able to manage uh, scheduling everything, and yeah, it's gotten me much more disciplined, in the sense now I know when to start, and I also have become very clean in reading. Like I know if I'm looking for something, I know exactly where to look at in a paper. And I've also understood at this point how a good paper looks like. Just because a paper has, I remember asking Dr. Terry Powell, this has big words, does that mean it's a good paper? No, not necessarily. Just because it's using I don't know, old Cambridge English does not mean it's a great paper. So these kind of things, it's always an amazing experience. I mean, and I'm so grateful for this opportunity. And shout out to the Student Digest and Mary Alice for sending out opportunities. And yeah, that's,
Great.
thank you.
Thanks. Thanks so much. Um, Great to hear a little bit about a day in the life. I know that MSPH students struggle a lot, and so it makes sense that you've kind of figured out the schedule and what works for you. Turning back to the project that you all are collaborating on, could you talk a little bit about like the public health impact of the project?
I'm gonna let Dr. Terry do this. She do.
Yeah, so I think the thing that we want to be able to do, right? So I mentioned that I work with schools, families, churches, anybody who I think that the way we think about public health here at Hopkins is public health is everywhere and everything, right? And so for us, our hope is to be able to synthesize the data that folks have talked about on how are we including community partners in this work, and then put it out into the world, right? And so like rather, so we're doing the work for other future researchers, right? Like future researchers won't have to go through 5,000 articles because we've done that part for them, and it'll be in one paper, right? And so I think sometimes like as you're thinking about what you do, whether it's here or wherever, like thinking about who the end users are and like the contribution you'll be making. And so like for us, we're like, man, this was a lot of work. Like we've been working on this like for months, right? And then we'll create this paper. And some of you, maybe if any of you have ever read a systematic review, like the amount of time and care those folks probably put into it It's a lot. And that's also a part of the research process. Like, so sometimes the research process isn't creating new, like getting new data, but really helping others in the field to understand what's already there, to make sense of what's already there. And we're doing that work for them.
Great, thanks so much. Drishti, any final words before we turn to the other project?
Guys, I'll tell you a secret. This is the best department, so apply.
Thanks, Drishti. Great. Well, thanks so much for sharing a little bit about your work together. And excited to hear more about it. Drishti, this is for your field placement, right? As an MSPH student.
Yes, we are required to do 680 hours, so this is a part of the field. Yeah.
Great. Yeah. So you're a 4-month field placement in the second year of the program, and that work for the field placement can turn into the master's essay. I'm not sure if you're planning on that, Drishti, but sometimes those experiences are linked. Awesome. Well, I will turn now to our second pair, faculty-student pair. We have Isabella and Dr. Beth Marshall. So could I ask the two of you to please introduce yourselves?
Sure. Isabella, do you want to start?
Sure. Hi, everyone. My name is Isabella. I'm a second year MSPH student, and my concentration is child and adolescent health. I have a research background in HIV-related research, and my research interests here in the department are really focused on adolescent health equity, especially including sexual health and mental health promotion.
And I am Dr. Beth Marshall. I'm an associate practice professor in Pop Fam, and I've been in the department. I came through as a student, so technically I've been connected to the department since 2000. I am focused on adolescent health and systems that young people are a part of and how they help them or hinder them from thriving. I focus a lot on schools and teach a course focused on schools and the connection to public health. Dr. Powell and I teach a course as well, looking at asset-based approaches to young people. And teach another course in the summer focused on youth voice and public health. So like Dr. Powell, focuses on adolescent health and a lot of work connected to communities.
Awesome. Thank you. So could you tell us a little bit about one project on which you're collaborating? Maybe again, if that project has an overarching research question and what your roles are and how you work together.
I'm going to start and then I'll turn it over to Isabella. So Isabella works with us on a project called, it's really called Hey Be More, which is like health and education for youth in Baltimore. Or it's actually health and employment for youth in Baltimore. But it's focused on an organization or a program here in Baltimore called Grads to Careers, which is a partnership across the Mayor's Office of Employment Development, Baltimore City Public Schools, and an organization in Baltimore called Baltimore's Promise. And so we've been working with them over the past 5 years to really do some evaluation of this program, really trying to understand the impact of Grads to Careers on the mental health of young people who participate in the program and how young people's mental health affects their ability to participate in the program. And Grads to Careers is really it's like a bridge program. So, we looked at a lot of data in Baltimore City, found that young people who were leaving the Baltimore City public school system weren't managing to have a living wage 6 to 10 years out of graduation. And so this was really an opportunity to grab young people who weren't continuing to secondary education and ensure that they had employment and career training, not just job training, but to really put them in well-paying careers. I'm going to turn it to you, Isabella, so you can talk about what you're doing on that project.
Yeah, so my role on that project has been to interview the young people who participated in Grads to Careers, to ask them about their experiences, to ask them to reflect on their mental health. Some folks who were not able to finish the program, to understand why that might have happened and how we could improve grads to careers moving forward. So that was really great. It was a really great experience to actually interface with young people living in Baltimore. And in those interviews, we're now analyzing, we're using like qualitative coding to analyze so that we can make recommendations and just improve grads careers moving forward.
Awesome. And Isabella, is this for your field placement as well?
Yes, yeah.
Great. Do you think that this will relate to your master's essay or TBD?
I think it will be separate,
Okay.
but yeah, it's been really cool. I've really liked this project so far.
Great, awesome.
So
So
fun fact, Sally.
yeah, yes.
Isabella will be working with me on her
Oh.
master's essay.
Awesome. Small world. That's
Small
great.
world.
It's great to hear, and it's interesting to hear about just your experience. And you mentioned that you're on your computer a lot doing these article reviews. Versus Isabella, you've been out in the community talking with people, and then feeding that info back to inform the program. So great to hear about how you can have different experiences, and then yeah, maybe for the master's essay you'll switch it up. So could I just ask a little bit more about Grads to Careers, the overall public health impact that you see this project having, or hope that the project has?
Yeah, I think that the idea of it is that if we can provide free and accessible, sometimes paid job training, that young people who are coming out of high school can have that opportunity for economic advancement. And when they do have that opportunity, then we propose that our communities are stronger, they're healthier and safer. Yeah, and these are youth who would otherwise maybe be disconnected from work or school, which is a population that our department is really focused on, disconnected youth. So yeah, we're just hoping that these interviews can be used to improve the support services that are needed to ensure that these programs are accessible to all young people.
Great, thanks. Yeah, awesome to hear how you're trying to give back to Baltimore. Dr. Marshall, anything to add there?
No, I just want to highlight that, what Isabella said, like we do have a good bit of focus on young people who are disconnected from education and work, and Grads to Careers was this sort of innovative approach to prevent that from happening. Typically, we look at disconnected youth and we figure out, oh, how do we reconnect them? But the idea was to have a bridge so that there was never a disconnection. And so, the work that Isabella's been doing, these interviews, are really connected to how do we ensure that these programs are really working for youth? Because this is an innovative model. So how do we make sure that it's really taking into account all of the facets of a young person's life that would help them thrive in a program or keep them from being able to, like Isabella said, some were not able to finish. So what was happening there? So it's really a great opportunity to ensure that an innovative program is going to keep going in the future and, work better for Baltimore's young people.
Awesome, thanks. I will let our participants ask questions to our panelists if you have questions in just a moment. But before we get to that, just want to talk about Baltimore a little bit more. And could I ask each of our panelists to share one thing that you like about Baltimore? Can I start with you, Drishti?
Honestly, I love Baltimore. The food, you have so many things you get here. And I've been very impressed because it's hard to find good Indian food. And I will tell you, I am not disappointed. I'm a daughter of a chef. My mother's a very famous chef back home. So when I'm saying this, it has a lot of weight. There's really good food here and the water. Okay, I'll leave the rest of the things for you all.
Thanks. Dr. Powell?
Yeah, I'm with Drishti. I love Baltimore too. And just, I'm not from Baltimore, so I'm from Chicago. Any Chicago people or Midwesterners? No? Okay. Hey, all right, Walter. So I'm from Chicago, right? So I think that like Baltimore has it all. It has enough of everything you need, right? If you are into sports, we got you. If you like the theater, we got you. If you are just here for school, also fine. You like the bar scene, great. Like I just think that there is the museums, if you have children, there's just enough of everything that you need. without feeling overwhelmed, right? Because, you know, if any of you are from much bigger cities, like Chicago's way bigger, New York, like it's not like that kind of overwhelming, like people on you everywhere, but there's like exactly what you need. And as a person from the Midwest, everything is close too. In my head, everything like you can be in like 5 different cities in an hour and a half, right? You can go down to DC, you go up to Philly, like New York. Like literally, I take the train up on a Wednesday to go to a play in New York. Like it's just a good time. So it's very conveniently located and it has everything you need.
Awesome. Thanks so much. Isabella, do you have anything that you would like to add?
Yeah, I think when I first moved to Baltimore, I heard a lot of people saying like Baltimore is a city of neighborhoods. Um, and it is true. It's kind of cliche, but it's true. And I think I've really loved my neighborhood and the sense of like community where I live, knowing my neighbors, and we just had Halloween and we got hundreds of trick-or-treaters, and it was such a blast. And being able to the quality of life, knowing your neighbors, I'm able to walk to school, I can walk to the harbor, has been really, really fabulous. And I've really enjoyed that part of living in Baltimore.
Thanks. What neighborhood do you live in?
I live in like Upper Fells Point.
Nice. Great. So there's a recommendation. Dr. Marshall, can I close with you about what you like about Baltimore?
Yeah, like everyone else, I am like a huge fan of Baltimore. It is an amazing place to live. And I think, you know, folks have mentioned the food is great, the art scene is great, the music scene is great. It's also like super quirky and like I love that part of it. Like it's hard to describe, but like I like Baltimore is just full of love. Like it is a good place with good people. Um and like it's a small city. So you get to experience all of that good place and those good people. So yeah, huge fan. Cannot say a bad thing about it. It's a like it is, you know, we have our stripes like any urban place, but we are an amazing place to live and study.
Thanks. Yeah, Smaltmore. All right, I will see if our panel or if our audience has any questions for our panelists before we let them go and turn to discussion of our degree programs. Feel free to type in the chat or come off of mute. But Nadia?
Um, Hi, thank you so much for having this info session. Really helpful and informational. So I was wondering, I know the two student researchers you just spoke are, I believe, MS PH students, but I was wondering, is it possible for, I'm a prospective MPH student applying into that program, so is it possible for MPH students to get involved in either of the research projects that were mentioned?
Yeah, Dr. Powell or Dr. Marshall, do you want to take that?
Yes, we love all students. No, seriously though. So I think that I don't know which MPH program you're thinking like timeline you're thinking about. So like we have the part-time, which can take up to 3 years, or the full-time, which is less than a year. And so the way that I have typically been involved with master students is as a capstone advisor. So because you're just like it's too fast, right? Like the full-time program is like so fast, right? So like there's not a ton of time to be involved in research. So typically like I see master students when they're like writing us something and then I have a something that they can write on and we can write together. So I you know like I depending on like how you spend your time, if you decide to do the part-time, you'll see us more often, see us more frequently. But if you're a full-time, like we'll still here. So I think that I would say, and Drishti gave a shout out to Mary Alice, our communications person, for the student dispatch. But the thing is, like, there's so many opportunities here, right? Like, I think it's not a matter of which it's like not a matter of like if you find them, but it's just like which ones you can say yes to because they're all interesting, right? And so I always tell my students interesting has to be the low bar because if you go after everything you're interested in, you're going to be overwhelmed and like saying yes to everything because almost like I really do I admire my colleagues. I think they do great work. I think I do great work. And so for students, like a part of it is more like trying to decide which ones work best for you rather than like finding one opportunity. So yes, welcome. We love all master students and doctoral students.
Thanks. I'll just add really quickly that the MSPH program in our department is a 2-year full-time program, and we'll talk more about it. But the second year of the program is the field placement in the summer and fall, and then the master's essay in the spring, as well as more courses. And the MPH program, if you do it on a full-time basis, it's a 1-year program. So I definitely MPH program is great. There are pros and cons to both, but one thing that I do like about the MSPH program is that there's just a little bit more time. But certainly there are still opportunities to collaborate with faculty if you do the full-time MPH program. And then you can also do the MPH program on a part-time basis, and go at a slower pace. Angela, do you want to ask your question?
Hello. Oh, hi. Hi.
Good.
First off, thank you so much for holding this session today. I really do appreciate it. I think the question that I have for our panelists is how have you been able to build trust between the different communities that we're serving, especially just given Hopkins standing in the city and given the mistrust between like the Baltimore community and Hopkins. I guess I'm just curious how you've been able to build trust with those communities.
You want? I'll start, and then anybody else can jump in. So I think it's a really good question, and it's really important. And I think, the way that we think about community engaged work is that it is a long process. It is not it's not a quick turnaround. Like I said, like we have been working with Baltimore's Promise in city schools and MOED on just the Grads to Careers project for over 5 years. And I think, the way that those partnerships started is that, we had worked on other things together before that. So it's a long history of working together and continuing to be present for partners, even when funding is not there to have a project together, right? We're always thinking about one another, whether that's funding opportunities that we see coming down or other opportunities for us to connect and to share our work. Like I'll give an example from Grads to Careers. Some of the data that we collected, our partners were like, we need this to go to legislators, right? Like, we don't need it to be in a paper. We don't need it. We need it in this format so that it can go to this audience. And so, I mean, that's not necessarily like the direction that we were going, but we will quickly pivot and do what our partner needs, because that's how the partnerships work, right? Like, we're there for one another. So it's not a like super specific question. It is a long process of like coming through for one another when there's not always something in it for you.
Yeah, and I'll just add, right? Like, I think generally we use the principles of good relationship, right? Like any relationship. So, honesty. Like honesty builds trust, like transparency, shared values, so I think that so we are researchers, like we're never not researchers, right? And so like when we start new partnerships, it's not like, hey, like now we're friends. Like maybe we become friends, but like, hey, here is what I have to offer. Here is what I like. How can we work together? And being okay when people say no, right? Like not everybody has to say no. Not everyone will be a partner. But that doesn't mean like, like I feel like there's probably some like musical artists that I'm breaking on. Like just because we're not friends doesn't mean we have to be enemies because it's small. Baltimore's small. So this is not the place to make enemies. And so I think that, like being honest about where we stand and what we offer and when we can be available, like Beth said, like showing up. Like I have partners where we did research and then all of a sudden they're like, hey, can you come to our career day? Yeah, sure. Like, or if I can't come, maybe one of my students can come. Like, hey, we having a back to school night, or like, we just were talking about Beth and I, one of our partners, we hadn't worked with them in years. They were like, hey, we need some articles about blah, blah, blah. Yes, of course, I have access to articles. This is an easy ask, right? So I think that just using principles of like good relationship, like communication, honesty, shared, mutual benefit. Those are the ways that we try to start partnerships and then continue them along the way. And Angela, you said something in your question like, oh, given Hopkins, like you're right, right? Like Hopkins is this big place. And I think what we found is people trust people, right? So I don't know that our partners would like necessarily say like Hopkins is my best pal, love that institution. But I do think that they'll say like love working with Dr. Terry and Dr. Beth. Like they're good people. So I think that we've learned to accept that as it is. Like we get to be good stewards of relationships. And then if we mess them up, we also have to be responsible for repairing them.
Thanks so much. I do want to be respectful of our panelists' time, and it's 12:30, and I want to make sure that we have time to talk about our programs. So, Wendy, I see your hand up. I'm sure that we can get to your question in a little bit. I also see some questions in the chat, but right now, just want to give a huge thanks to our panelists for talking about your projects and sharing your insight about the work that you do and a little bit about Baltimore. We really appreciate it. So, thanks a lot for joining us.
And
So
we
our
are both
panelists,
super easy to find. Like if you
yes,
have a question, just email us.
yeah, thanks.
Thanks, Sally. And you can feel free to drop our emails in the chat when it's all done. So thanks, y'all.
Awesome.
Have a good day. Thanks, Sally.
Thanks a lot. All right, so I'm going to turn back to my slides and talk a little bit about the program. Let me answer a couple of quick questions in the chat. One is, do I need to get a faculty member to supervise me before I apply to the department? You don't need to have a commitment from a faculty member to supervise you before you apply. You're welcome to reach out to faculty if you feel like talking with them would be helpful, but faculty are not always able to respond. And if you were admitted to the program, we match you with an advisor. And that's true for both our master's programs and our PhD programs. And then I'm seeing a lot of questions about the PhD program. There was one about flexibility to complete the coursework in the PhD program online. The PhD program is an in-person program, and it does have a residency requirement where we expect students to be here in person for at least the first year, but often students will stay here beyond that. We have a DRPH program at the school. It's a pretty different focus. I'm happy to talk more about that if you would like, but that can be done on a part-time online basis. That's a doctoral level program. And there's a question about whether the PhD program has field placement opportunities. Are students able to do international research? And so the PhD program, students do engage in research. All of our PhD students also, generally have a work requirement. And so a lot of our students are working about 20 hours a week as research assistants with a faculty member. That we have students who are PhD students who are working with Dr. Powell and Dr. Marshall right now. And I see that Drishti put in her LinkedIn. So let me go through a few more slides. I'll be quick so that we can try to make sure that we have plenty of time for questions. Can you all see my screen okay? Great, thanks. So let me go through our programs. Again, there are more, including the MPH program and the DRPH program that do have affiliations with our department. Happy to answer questions about those, but I'm going to give a little bit more detail about our Master of Science in Public Health or MSPH program, which, like I said, is a full-time in-person program, as well as our MHS, which can be done either part-time or full-time in 1 year or part-time in up to 3 years. And then we have our PhD program. Students typically take up 4.5 years to complete that. The first 1.5 years is coursework, and then students move on to mainly proposal and dissertation work. And like I said, for the PhD program, we do require students to be here for at least the first year in person. So our MSPH degree the first year is set up for students to engage in full-time coursework. And then in the summer and fall of the second year, students are working full-time usually for the field placement. And it needs to be at least 4 months of work for the field placement. And so sometimes students will do something for 2 months full-time over the summer, take a little bit of a break, and then do something else full-time, or some of our students are doing simultaneous field placements. And then in the spring, our students focus on the master's essay as well as doing some remaining coursework. Both our MSPH program, MHS program, and PhD program are STEM designated. So that is an important consideration, I know, for some of our international students. Here's just a few pictures of our students engaging in field placements. I think these are mostly from last year, but there's a big range in what people do from, and similar to what you heard about today, where some people stay at Hopkins to do research. Others are engaged in outreach work here in Baltimore or abroad, and really a big range from research, policy, program, practice, evaluation, and students find their own field placement, so there's a lot of flexibility there. Here's just a few examples of the master's essay. So these are master's essays. Again, both our MSPH and our MHS students will engage in this experience. You can check out our website to see videos of recordings of past presentations of the master's essay. Again, there's a big range of what people do. Students get to pick their own topic and their own reader, so a lot of flexibility. As I've said several times, sometimes the master's essay will relate to the field placement, but sometimes it can be a new project. And I always tell students that the master's essays presentations are really one of my favorite times of the year, because you get to see what students are most passionate about as they select their projects and engage in really exciting work. Like I said, we also have the MHS program. So the MHS does not have a field placement, and it can be completed in a shorter time frame, just 4 terms if you want to do it on a full-time basis. There's somewhat similar coursework to the MSPH, but there's also some additional coursework related to research methods, competencies, but students are still will engage in the master's essay, similar to the MSPH. Just a few notes about our PhD program. Like I said, students generally take 4.5 years on average to complete the program. There's a lot of coursework related to content area. So this will, everybody takes a course on life course perspectives, and then some of the coursework depends on your area of interest. We also have a lot of coursework that's focused on research methods, thinking about designing studies all the way through collecting data and data analysis. Our students engage in doctoral seminars where you get guidance from faculty, both just to enter the program and think about your own research identity, prepare for exams, including oral exams. And then our students are also engaging in research assistant and teaching assistant opportunities, and again, having specific points throughout the year where you're kind of reflecting on your progress, setting goals for the doctoral program. This year, we're recruiting PhD students in 2 of our 4 areas of interest. So we're specifically looking for folks who are interested in child and adolescent health and women's sexual and reproductive health. And we're focusing on those areas of interest because that is where we see the most opportunities for faculty guidance, as well as funding opportunities, because again, our PhD students do have a work requirement typically throughout the program, where you're working about 20 hours a week. This is another way of looking at the PhD program. So like I said, the first 1.5 years is focused on coursework. Then students do take a comprehensive exam, both a written and oral exam, to ensure that you are able to evaluate research and critique research. Then you move to proposal development, where you will select a dissertation topic and write a proposal with your faculty advisor. And then you go through some preliminary exams, oral exams with the faculty committee to ensure that you are able and ready to start conducting research independently. And then you do your dissertation, and it all ends in a final defense. A couple more words about our PhD program. I encourage you to explore the faculty directory. I recommend that for our master's students as well, to make sure that there are faculty here in the department who are working in areas that align with your interests. So you should make sure that there are some faculty who you can see yourself working with, but at the same time, you don't need to have somebody like agree to be your mentor. This is not a traditional apprenticeship program where we would like assign you a dissertation. You are going to have flexibility to decide on your dissertation topic, but you will be working closely with faculty through courses, through your work appointment, and so there's a little bit of it's a mix of wanting to make sure that you have the right fit, but we're not going to assign you a dissertation. Few more quick notes before I get to questions. I want to make sure that all of our students know that if you come to a degree program, you will have your program requirements, but you can also complete certificates while you're here. So many students find certificates that are either offered in the department or outside of the department that align with your interests. And that would be like an official note on your transcript to indicate that you had completed that additional coursework. And students can often fit that into their elective credits, so it's not like you are paying extra tuition. And I think almost my last slide, I think I have 2 more slides. This is just a note about the centers that we have in the department. So if you go to our main PFRH website, you can click on these and learn more about the work of faculty and centers in our department. And final note, I'll say that there are a lot of opportunities outside of the classroom, opportunities to engage with other students and faculty beyond course requirements, beyond those certificate requirements. And so there's just a few pictures here of activities that have occurred in the past year or so. I will get to specifics about admissions, but let me pause for a moment and see if students have questions. I think that there are a lot of questions in the chat. Anybody want to come off of mute and ask a question at this point?
Yes, can I ask a question?
Yeah, go ahead.
Yeah, so you said that PhD students have to work. Is that work just teaching, or are there other kinds of work?
So the most common work appointment will involve research assistant positions. So working with faculty on their research projects, somewhat similar to what our master's students were talking about today, maybe just at a different level for PhD students. All of our PhD students are required to TA at least 2 courses, and those are generally larger department courses. And some students for their work appointment will just be doing teaching assistant positions throughout their time here, but it's more common actually to engage in research assistant positions. Gideon?
Hello, thank you so much for the presentation. I just have 2 questions. So I wanted to, because I sent an email sometime last week to ask about some specifics in terms of like the expected length for the personal statement for the PhD program, and also to get a sense of the kind of research projects that are currently ongoing in the Women, Sexual and Reproductive Health program. Thank you.
Sure. So I think one of the best ways to find current research projects in the department are to go to our website. And again, you can look at the different centers on the website and see those. They will often have like individual websites that describe their programs. You can also look at our faculty directory, and that will often include some of the big project highlights that our faculty are doing. And then continuing to attend virtual info sessions like this, we try to have a good representation from faculty across the department who are collaborating with students. So that should give you some sense of what students are doing. And then for the personal statement, others are welcome to weigh in, but I would say for the personal statement, we want to learn about your journey, understand a bit about your background and what you've accomplished, and as well as your goals and why the PhD program specifically the PhD program in the department is right for you and how it's going to give you the training that you need to advance in your career. And so we overall, looking at your application, do want to see that you've engaged in research to some extent and like are fairly confident that you want to continue down that path. And again, just seeing, we'd like to hear from you what you are hoping to gain out of the department. Ishrafan, I'm sorry if I'm mispronouncing that incorrect.
Hello. No, you're just saying it right. So I had a question about the MS-PH program. So like, is there any funding opportunity available for international students in the MS-PH programs?
Sure. So our I am actually gonna, let me turn back to the slides because I think that I have that in just a couple slides. So stay tuned for just a minute. Very quickly, our application deadlines, if you want to apply to the PhD program, those are due December 1st. And you have a couple of extra weeks to submit supporting documents, but you need to get that SOFAS application in with like your personal statement and the SOFAS application by December 1st. If you're interested in one of our master's programs, that is due March 1st for an August start. This just shows what all you need to complete for the application. So again, the SOFAS application, letters of recommendation, we need all of your official transcripts from any university that you've attended, even if you don't have a degree from there. You are welcome to submit the GRE, but that is optional. I would recommend submitting the GRE if you don't, if your application is kind of lacking in demonstrated quantitative ability in particular, that can be a good way to strengthen your scores. And then for our international students, there are some additional requirements depending on, like if you graduated from a English-speaking school, so you can check that out. We can also try to add the link, but there are some additional requirements for credentialing for transcripts as well as English language proficiency. But here's the slide that I wanted to answer your question. So all of our MS-PH students who are in good academic standing receive a 75% reduction in tuition in year 2 of the program. And so that's the master's tuition scholarship. And so across the board, as long as you're in good academic standing, you will receive that scholarship. We also have a need-based scholarship at the school level for our MS-PH students, and that covers 50% of tuition costs in the first year of the program. And so we give preference to students who are first generation and have exceptional undergraduate academic records, as well as financial need. And this is open to international and domestic applicants. So if you want to be considered for that scholarship, there's some additional info that you need to submit by March 1st, including the CSS profile. And then for our MS-PH program, we do have some additional scholarships, and you will be automatically considered for those. Those depend a bit on like your specific area of interest, but we prioritize students who have strong academic backgrounds. And again, you'll be automatically considered for those. Our students also engage in paid research assistant and teaching assistant opportunities to receive additional funding as students in the program. So that's for the MS-PH program. For the PhD program, to reiterate what I've said before, the stipend for PhD students is $50,000 per year with an expected annual increase for cost of living. Students receive, in the PhD program, students also receive tuition fees and health insurance, and that is guaranteed for the first 4 years of the program. But along with that funding package is an expectation to work. Again, most of our PhD students are working about 20 hours per week on top of their academic work. So I have this slide with our email addresses and our social media pages if you would like to stay connected. So if you could take a note of that, that would be great. But I'm going to stop sharing the screen, and now we can just focus on questions for the last few minutes of our time together.
Could you put the information back up? I didn't get a chance to take a screenshot.
I will put it in the chat.
Thank you.
Yep. Is anybody, any particular questions? I see that there's a lot in the chat and some people have been responded to. I see a question in the chat about your transcript for, and I think it possibly was a non-US institution. So you can reach out to the admissions office about this, and we can also try to put a link in the chat for the instructions for international applicants. But like I said, there is a hard cutoff for supporting documents due by, I think it's December 23rd this year. And so we would, in order to, sorry, that's for PhD applicants. We can give you the deadline for our master's programs as well. The main application is due March 1st, and then there'll be a couple of weeks, I think, for getting your supporting documents in. But there is going to be a hard cutoff to get the transcripts in by that date. All right. What other questions do you all have? So we will, I see a question in the chat about the recording. We will post the recording on the website where you registered for this event. And I believe we can also send it out to everybody who registered. So we'll make a note of that. Isha or Aisha?
Yeah, hi. Quick question for the PhD application. I know there's a separate question for indicating which faculty we would like to work with, but should we specify who and why in our SOP as well, or yeah, okay.
Yeah, great question. Yep. So in the SOFIS application, we do have a question about faculty that you're interested in working with, and you could share a few names there. I would also recommend talking about faculty with whom you're interested in working in your personal statement and talking a bit about specifically why you want to work with those faculty. Again, we really want to see in your personal statement, why this is the right fit for you, and make sure that we have faculty to support your interests. So yes, I would say put it in both places.
Okay, thank you.
Yep. I think I heard somebody else come off of mute and say that they had a question.
I had a question.
Ryan, yes.
Hi, Sally. Thank you for the presentation. So I was going to ask, my transcript, I'm wrapping up my MSc by January, and my entire transcript will not be ready by December 1st. Just, I think the transcript for Term 1 or Term 2 will be available by that time. So how do I navigate this?
So, Kristen or Gilbert, feel free to weigh in, but if you have attended school, you should submit a transcript for grades that you have for courses that you have completed. And then if you were to be admitted, like if you're taking classes in the spring semester, we would require you to send us an updated transcript by the time you started the program. But you do need to send anything that you've completed so far, you need to submit that. But Kristen, any?
That's correct, yes.
And then I see a question about PhD application. Yep. Letter of recommendation needed before the deadline. So supporting documents, you have a few weeks. So the SOFIS application personal statement is due December 1st, but then you have a couple of weeks to get in your supporting documents, including letters of recommendation and transcripts. Any other questions?
Is the deadline for the MSPH and MHS programs in the spring?
Yes, March 1st for the master's programs.
All right, thank you.
Great. So like I said, we can send an email out to everybody with the link to the recording as well as our contact info. Thank you so much for joining today. If you have questions as you work on your application, please let us know, but I hope that you will apply to the program. And then I see a question about what makes applicants stand out for the PhD program. So I'll answer that, but if you need to hop off now, feel free to do so. And again, thank you so much for joining. But I'll turn now to what stands out for the PhD application. Gilbert, do you want to take that one? I'm also happy to take a stab at it if you prefer.
Yeah, it's a good question. I think one of the first things that we look for is a fit to the program. So that includes your area of interest, of course, whether or not we can assign you to a faculty member. So just making sure, there's a fit there. Having a strong application, which of course includes good grades in undergrad, master's program, what I would consider relevant work experience in the field, and highlighting your research, whether it's papers that you've authored, papers that are currently, making their ways through publication or making the publication process, things like that. So it's really a holistic review, but those are some of the things that I would say would make you stand out.
Thanks. Any final questions in our last 2 minutes?
I'm not sure if I missed it, but will there be another meeting or another session, particularly about the PhD programs?
So we will have more virtual info sessions like this, but probably not until like January, and a little bit later in the spring once the PhD application has passed. We'll have some info sessions for admitted students in the spring, but we don't have another just like PhD specific session before the December 1st deadline.
All right, thank you so much.
Yeah. Ashrafan?
Hi. So like he said, but if I don't have a publication yet, or I just have a thesis, so like not having a publication, does this consider to be what should I say? I'm planning to apply for the PhD program. So does it consider as a drawback in my application?
I think having some publications definitely strengthens the application. And so we look at applications holistically. So we'll be looking at your academic performance, your recommendations, but definitely for the PhD program, which is quite competitive, it is certainly a strength if students do have at least a couple of publications, either and if you have a first author publication, that is an additional strength. So it's not like you'll be immediately omitted, but it does strengthen your application to have that.
Thank you.
Mm-hmm. Tiku, I think that my response to your question, is similar. So like Gilbert is saying, not absolutely required, but if you don't have a publication, you could submit a writing sample, such as a thesis or something like that.
Thank you. Yeah, I think that's very helpful. I have co-authored, but I don't have a first publication. So yeah, great to hear that I can submit a writing sample. Thank you.
Yeah.
Just to be clear, co-authorships are fine as well, right? You don't necessarily have to be first author. Just show that you have some type of research experience, or you have the capacity or the capability, I could say, to do research.
All right, it is 1 o'clock. So again, want to be respectful of everybody's time. If you want to hop off, please go ahead. I'll stay on maybe just a couple more minutes for any final questions. All right, well, if not, I think we will end the session. So thanks everybody again for joining. Hope you enjoyed hearing from our presenters, and feel free to reach out if you have any additional questions. Thanks all.